Well, good evening from Australia. It's Kevin Rudd. I'm president of the Asia Society Policy Institute. I'm normally based in New York, where the Asia Society itself is headquartered through our global network. But because of COVID-19, for the last 2 months, I've been in Australia, my country of origin. More importantly, tonight I'm joined by two guests, one coming to us from the United States itself, from New York, and the other from London. I'll come to them in one moment. But I wanted to emphasize again what we are doing in this particular webinar, and that is to examine the impact of COVID-19 on those parts of the world which are already suffering a humanitarian crisis of one form or another, and how the COVID crisis has added to that, or whether the COVID crisis has made no material difference to it. That's why we want to listen to our two panelists this evening, because they bring to bear a wealth of experience. And we are joined tonight by Valerie Amos, who's director of the School of African Oriental Studies at the University of London. She joined SOAS in September 15. From 2010, she served as the UN's Undersecretary General for Humanitarian Affairs and Emergency Relief Coordinator, otherwise known to those of us in the trade as UN OCHA. She served a number of roles in the public sector prior to that, and also was made a Labour Life Peer in the British House of Lords back in 1997. Prior to that, again, she was a Foreign Office Minister, Secretary of State for International Development, Leader of the House of Lords, and Lord President of the Council. Valerie, you can explain to us what Lord Presidents of the Council do, but it all sounds impressive to those of us here in Australia. Valerie is joined tonight by David Miliband, also, like Valerie, a friend and colleague of many years standing. David is now President and CEO of the International Rescue Committee. He oversees the agency's relief and development operations in over 30 countries, its refugee resettlement assistance program throughout the United States, and the International Rescue Committee's advocacy efforts in Washington and other capitals on behalf of the world's most vulnerable people. David, of course, has had a distinguished political career in the United Kingdom prior to joining the IRC. From 2007 to 2010, he served as the youngest Foreign Secretary in 3 decades, driving advancements in human rights and representing the United Kingdom throughout the world. In 2016, he was named one of the world's greatest leaders by Fortune magazine. You'll have to tell me, David, how you managed to achieve that. And in 2018, he was inducted into the American Academy of Arts and Sciences. I didn't know that either, David, so I'm impressed when I now review your CV. More importantly, both David and Valerie are genuinely global citizens. And as global citizens have seen it as their responsibility in life to act on behalf of the interests of the peoples of the world, well beyond the dictates of the national interests of their nation state. Hence Valerie's work for the United Nations and the critical work she did for UN OCHA, and the work which David now does on behalf of the International Rescue Committee in countries around the world. Before I go to David in the first instance, a few thoughts about where we stand today as far as the humanitarian crises around the world. I think it's important for us to understand that when we look at the world today, there are many, many areas where in fact we see ongoing humanitarian crises which well predated the arrival of COVID-19. In the Middle East, we think, of course, of Syria and Yemen, but not just those two countries. In Asia, we think of the Rohingya and the displacement still in Bangladesh. But beyond those relatively well-known areas of humanitarian crisis, there are many, many more as well. And here's the dilemma. COVID-19 has not left these communities alone. It's compounded the problem directly. But on top of that, because of the impact which the COVID crisis has now had on nation states around the world, it's also affected the funding base of humanitarian agencies such as the IRC and others in the UN community in handling these crises, ongoing crises on the ground. And that's why we'd like to hear from both David and Valerie in terms of what can be done in the future. So that's the reason we are gathered here this evening. We want to understand where the problems are most acute and, most importantly, what the international community can now do about them, both in the immediate sense and where our humanitarian agencies go in the future. So, David, why don't you give us 5 or 10 minutes, a snapshot, an overview, a tour d'horizon of, let's call it, those parts of the world which constitute our gravest humanitarian crises today, and what COVID is doing to those areas. Over to you, David Miliband.
Thanks very much, Kevin. It's great to be with you. I'll probably be close to 5 minutes to make it more of a conversation, because you and Valerie have got a lot to offer on this. I think that I want to remind your listeners, your viewers, of the starting point, that we went into the COVID crisis with really unusually high levels of humanitarian distress in fragile and conflict states around the world. Record numbers of refugees, record numbers of the internally displaced, very large number of civil conflicts continuing to burn. And in 80% of the 35 to 40 fragile and conflict states around the world, the countries were off track to achieve the Sustainable Development Goals that were so loudly proclaimed 5 years ago, by the member states of the United Nations. So that was the backdrop to the COVID crisis. New inequality between those in fragile and conflict states, who now represent about 45% of the world's extreme poor, and the rest. If you live in a stable country with a market economy of some kind or another, whether it's an autocracy or a dictatorship or a democracy, you had a reasonable chance of upward mobility. If you're in a fragile conflict state, you didn't. And in the fragile and conflict states, COVID represents a double emergency. And I want to put that onto the table as a basis for our discussion. A health emergency, which could take your life, but also an economic and social emergency, which could take your livelihood. And let me briefly just review those two aspects, getting into some of the geographies that are most exposed. Let's start with the health emergency. This crisis is hitting the poorest hardest. But what's interesting is that the poorest in terms of the fragile and conflict states around the world are actually not those who are currently being hit hardest. It's the poorest in advanced industrialized countries, in Europe, in America. But I think our fears for the people that we serve in fragile and conflict states are founded on the following factors. The comorbidities associated with COVID are quite strong. Acute malnutrition, 18 million acutely malnourished under fives in the fragile and conflict states. High levels of population density. You mentioned the 1 million Rohingya in Cox's Bazar in Bangladesh. I also think of the 3.5 million people in northwest Syria who the International Rescue Committee is serving. I also obviously think of people in refugee camps. About 5 million refugees are in refugee camps. It's generally there's a misunderstanding. This you know, but I think many others don't, that most refugees are not in camps. These days, most refugees are in urban areas, not in camps. But the conditions in which they live have very poor sanitation. Another contributing factor, 3 billion people around the world have no access to running water in their own homes. And that is particularly acute in some of the conflict hotspots around the world. Now, there's one factor that weighs in the other direction for the conflict-affected populations, and that's their relative youth. Half of all refugees and displaced people around the world, there are 70 million, are under the age of 18. And as we look around the world and see the progress of the disease from its epicenters first of all in Europe and then in America, and now look at the movement, one thing that can give us hope is the relative youth of the population. And so if you look around now, you'd then say that after Europe and North America, the Americas, South America, Latin America is now particularly at risk. We're especially concerned about the situation in Venezuela, which obviously has the combination of health danger. 90% of the health system has been compromised over the last 5 years by the flight of people, but also the economic meltdown, and I'll return to that. But other parts of Latin America, I'm thinking about Ecuador as well, significant spikes in the number of recorded cases. Now, after you leave Latin America and start thinking about Asia and Africa, or Africa and Asia, the evidence becomes very foggy because the amount of testing is very poor. In countries like the US, European countries, 35 to 45,000 people per million of population are being tested for the virus. In Nigeria, you're down, way down from that. Some figures from a week ago, only 150 per million of population. Mali, below 100. Yemen, 31 people per million of population. And so as I begin to describe the picture to you in Africa and Asia, the compromise on the statistics makes it especially difficult to be precise. However, we do see rising tolls in important parts of Africa, notably in Nigeria, but I want to come back to that. Afghanistan and Pakistan is a significant worry. Significant rises in the number of recorded cases there, albeit on a low base. And so out of that, you then move to the Middle East, where actually the lockdowns have been imposed particularly early. Many of your listeners may think about the significant numbers of refugees in Lebanon and Jordan. The lockdowns in those countries, I think, have protected people in those countries well. But Syria is a black box in this. There's no statistics at all. Government's obviously not in control of the Northwest and the Northeast, and we're especially worried. Although I do want to say this just in all honesty with you. If we'd been having this podcast 2 months ago and you'd said, we're going to be meeting again on the 28th of May, how much further do you think the disease will be going? Do you think your health centers will be overrun? I would have said there's a high chance of that. And I can report to you today that our health centers are not being overrun. So notwithstanding the low level of testing, it's not yet the case that the hockey stick image of the disease rising exponentially has hit the people, at least in the way that we fear. Nonetheless, the Latin American evidence over the last week, complementing the European evidence, makes our epidemiologists extremely concerned about what's coming next in Asia and in Africa. Let me just say a couple of other points. I said the second part of the emergency was an economic and social emergency. And I want to pick out a couple of countries that are particularly exposed because of their dependence on the oil price. The cratering of the oil price, coincidental with the start of the COVID crisis, means that countries like Nigeria, like Venezuela, like Iraq, are especially exposed to the economic as well as the social, as well as the health consequences of the crisis. And for the people that we serve, we're an international aid agency working in 34 fragile states outside the US. The people that we serve are living on the margins, they're living on the precipice. And that means that the fall in economic activity that has been triggered by the COVID crisis, as I say, there's been good early lockdown in a number of the places that we work, learning the lessons of the mistakes in a number of Western countries, means that there's been a saving on the health side, but obviously the economic consequences are real. I just want to flag also social consequences. What we do know is that violence against women goes up significantly in humanitarian crisis, and our anecdotal evidence is very much speaking to that as well. So when I speak of social and economic collateral damage, I'm not just thinking about the pure impact on livelihoods, although that's real, but also the social collateral that goes with it. So in summary, this disease is not an equal opportunity disease. It hits the poorest hardest, but at the moment, it hasn't yet hit the poorest parts of the world. And that maybe sets the stage for you to have a discussion about this. But when we come back, perhaps in the second half of the discussion, to what needs to be done, I'll be flagging that there is preventative work as well as therapeutic intervention that is going to be necessary, and that for which there is still some time.
Thanks very much, David. Before I go to Valerie, just to probe you on one question, which is, you mentioned before your in-house epidemiologists. IRC is a big operation. You operate in many countries. And I think if I paraphrase you correctly, that the concern on the part of your epidemiologists is what you're now seeing unfold in Latin America. Prospectively is a story we may now see in both Asia and Africa. Have I got that right? And digging down into that a little bit, what's their basis for that sort of projection?
Yeah, I mean, I think I put it slightly differently. what they saw in America and in Europe was a consistent curve in the disease. And what we've so far seen in Asia and Africa is a curve that doesn't follow that pattern. It's flatter. We now have the Latin American evidence, which also follows the European and the American curve. And that reinforces our principle of preparing for the worst. We know that demography and other factors are different in Asia and in Africa, so we can still hope for the best. But the Latin American experience is just a third significant part of the world where the curve of the disease has been repeated and has had this rather rampant quality. As yet, we don't see the rampant spread in the places that we're working, but we remain fearful that it is coming. And the fact that it's now come to Latin America on a similar trajectory to that we've seen in America and in North America and in Europe means that we continue to be or that they continue to be fearful that in the end it will come on that exponential growth basis in the places that we work.
Thanks very much for that. It is, of course, one of the continuing questions or reasons for puzzlement in the international community, given what we've been bracing for across developing Asia and across developing Africa. Whereas the data, to the extent that we have it, mindful of what you said about low testing rates in those two parts of the world, is thin. It's still been of general puzzlement that in terms of the externalities that would be obvious in terms of presentation at hospitals and certainly people dying, that we still do not have the same phenomenology that we've seen in the other three continents. Is that a fair summary?
Yeah. And maybe I should just make it rather dramatic since you're going to pass it on to Valerie. Look, there have been 3, 4, 5, 6 times as many recorded deaths in the UK as there has been in the whole continent of Africa. So, that's a measure of the mismatch. But more than 1 billion people living in Africa. You've got 65 million people in the UK. So, and obviously many of the comorbidities in Africa you'd fear would be greater. So there is a puzzle, you're right. But and by the way, it's important to say, the measures that have been taken by African countries and Asian countries and Middle Eastern countries have contributed, we think, to the limitation of the disease. But nonetheless, we think it's too early to say that those parts of the world are going to be spared.
So Valerie, you'll be pleased to know I won't ask you what you're doing wrong in the United Kingdom, because that's not the focus of our discussion here this evening. But Valerie, you spent a long time working with the United Nations as head of the UN Office for the Coordination of Humanitarian Affairs. You've seen multiple humanitarian crises over time, and you have been in the centre of coordinating the international humanitarian response. Can you give me your view of how the agencies have responded so far across the world? And given the depth of your own experience, your reflections on what they could do more or better in the future. Over to you, Valerie.
Thanks very much, Kevin, and very good to be having this conversation with you and also with David. And I want to build a little bit on some of what David said in the context of what is happening here in the UK, the US, in Europe more generally. And I think one of the things for me that this pandemic has showed us so very, very clearly is the scale and the depth of the inequality in countries like the United Kingdom and like the United States, and the differential impact that the pandemic has had. So you have an operational response, but you also have a policy and a political response. And it was quite shocking for us, I think, in the UK when we saw the figures and the huge impact that the pandemic was having on Black and minority ethnic communities, which is also replicated in the United States. And there are a whole number of reasons for this, potentially, and they're still being worked through, but there is something about that inequality which persists. And then, of course, there's the inequality between countries, so the messages about lockdowns, social distancing and so on, the difficulty in some countries in the world of being able to go down that route. So what has really shocked me, I think, is the lack of a collective, coordinated response across countries and learning from the lessons of other countries. The real lack of a political leadership, despite the efforts of Dr. Tedros and the World Health Organization and the UN more generally, each country essentially going off and doing its own thing. And clearly, when you have a pandemic of this kind of scale and impact, it's really important that countries across the world are able to work together. And more importantly, that they're able to give support to those countries that don't have the same kind of resources that we have in countries like the UK and the US. Then there has been that overarching political message, which again has been so shocking for some of us, where we have seen discrimination, racism in terms of racist behavior, racist messaging, which at a time when people are already fearful of each other as a result of the pandemic, where they're being used to vilify different communities. And we're seeing it here in the UK with the rise that we've seen in the kind of abuse that we have seen against some communities. Of course, it's dampened down because people have been staying at home, but it is there. And we're seeing it, I'm in education, we're seeing it in the kind of messages that we're getting from potential students about whether or not they want to come to the UK in the future to study. So I think there is a huge amount for our political leaders to reflect on, but I also think that the international institutions need to, as it were, reinsert themselves into this process and give much clearer guidance. And in a way, we need to force our leaders to work together. We've had some of our previous leaders, Gordon Brown, for example, who has talked about the examples of what happened when we had the global financial meltdown and the need at that time for countries to work together. We urgently need that now. And that's the kind of failure that I'm seeing, both at an operational level, but also at a wider policy level and also at the political level.
Thank you for that, Valerie. What's common between your presentation and what David said before was the fact that, to paraphrase David, he said that COVID-19 is not an equal opportunity disease. It is highly discriminating in terms of poverty and disadvantage within developed countries, and certainly in the spread of countries, both developed and developing. This is a message which does not seem to have fully penetrated the wider public in their analysis of what's going on. That's one thing which is common to both of your remarks. But the second element of what you've just said, which I'd like to pick up, is something which all of us who are global citizens by instinct have been not just puzzled by, but horrified by, which is the absence of strong global leadership on this. Yes, the international institutions have ground into gear. Yes, the WHO has sought to perform its functions, drawing on experiences learned from Ebola only 6 or 7 years ago. But it strikes me that one of the things that is different, radically different, is the absence of American global leadership at a time like this. That is, America turned inward, and then when it wasn't turning inward, was blaming either the Chinese or the WHO. And that leaves to one side the actual origins of the virus in Wuhan and how it came about, and the transmission and early problems with non-notification in China itself. But if we're looking purely at this question of global leadership, to what extent does this end up, frankly, at the feet of the Americans? In a normal crisis of this order of magnitude, all eyes would go to Washington and ask, what is America doing? And then they ask, and what's the UN doing in partnership with America? But your reflections on that, given your formidable experience.
So, Kevin, for me, the fact that that American leadership is not there really points to the vacuum that you have in the way that the world has not moved on in thinking through where can or which countries can collectively fill that gap. We've not managed, for example, and we saw the indecency in the Security Council discussions when they were trying to get a Security Council resolution on COVID-19, with the fight, as it were, between the US and the rest in relation to what was said about China. In the meantime, we're seeing these figures go up further and further. We're seeing even within the US itself, the way that the response has been different across different states, and the lack of leadership at the federal level and by the president. And I think what this has pointed out is that we have looked to those international institutions and the leadership of the US in those international institutions, and we haven't yet moved on to what replaces that. So the international institutions have themselves, it feels like a smaller voice because they are threatened by the US, for example, saying that it will take its funding away, and again, taking its muscle away in terms of bringing countries together. The European Union countries, through the EU, have been fighting their own battles, as it were, in terms of reasserting the important influence of the EU. The UK has been very much going it on its own because of that history of wanting to leave the EU and the battles around Brexit. And of course, China is still holding its cards very close to its chest in terms of the kind of role that it would like to play internationally. And when you have a pandemic like this that is affecting countries in this very deep way, a country is not necessarily going to put its hand up and take that leadership which is required. So there's a vacuum here, which I think is very, very hard to fill. And I think that the United Nations, the Secretary General and others have been trying very hard to do that, and particularly to point out not just the consequences of the pandemic now, and David spoke very powerfully about the social impact, what is happening in terms of violence against women, those wider protection issues in terms of women and girls, the issues around the rise in mental health and so on. All of those are absolutely critical and important, but we're also around the world going to see a bigger rise in issues like food security. What support are we going to be giving to refugee populations around the world as we see the amount of money that countries put into the international system perhaps falling? So there are the day-to-day issues that countries have to deal with, but there are some bigger and wider issues with respect to fragility, conflict, food security that will be exacerbated by this pandemic. And I really worry about which countries will take leadership in terms of us dealing with those. And David, of course, is there on the ground seeing this day by day, and it would be great to have his reflections on which countries or institutions might take more of a leadership role there.
So David, building on what Valerie has just said, right now on the ground, you've identified the theatres where you are most active and those where you already see a COVID impact. You've made particular reference to Venezuela. Let me ask this question. In terms of your operations on the ground and what you are aware of with your, let's call it, partner agencies from the UN system, UNHCR, UNICEF and the rest, to what extent do you currently have a resourcing problem? To what extent is there currently a coordination problem? And let me then go to this question. As you project ahead, and bearing in mind what you said before about the potential roll-on of the COVID crisis into developing Asia and into developing Africa, what do you foreshadow as being the resourcing and coordination challenge which lies ahead of us. Over to you, David.
Thanks. Just to be clear, I mean, the countries that we are most concerned about at the moment include Venezuela, but I would highlight Nigeria, Burkina Faso, I would highlight Syria, I would highlight Yemen, I would also highlight Afghanistan and Bangladesh, just for the, if you want a top five, those are of really, and I would also add, maybe rather than Burkina Faso, I would say Democratic Republic of Congo. I mean, a country the size of Western Europe, 100 million people.
So we're up to 8 there. So
5 ventilators. So I mean, well, I think that if you think about scale, you'd probably think DRC rather than Burkina Faso. Yeah. Look, I think there's a way of linking your question to what Valerie said very clearly. The crisis has exposed the absence of international resourcing, coordination, leadership, but it also threatens to deepen the fissures in international coordination and leadership. You, don't want to embarrass you, but you've written very eloquently about this most recently in Foreign Affairs, which I tweeted your article from yesterday, which made a rather profound point that in their competition, America and China might both end up being losers out of this crisis, which I think is a profound point. People think of the US-China relationship as a zero-sum game. Actually, from being what many of us would see as a positive-sum game, it's going to become a negative-sum game if we're not careful. Right. And I think but that point, that the crisis, yes, has exposed this leaderless world, the vacuum, the G0, but it also threatens to make it worse, I think is real. And it would become worse because of competition between the US and China, a blame game that could lead to all sorts of diversionary tactics, both from the Americans and from the Chinese, whether on Taiwan or trade. It also threatens to pull Europe, to strain the sinews within Europe, which I think would be worrying. So the crisis does threaten a further weakening of global order. Now, you asked about resourcing and coordination. So here's the way I would think about it. I think if we imagine that this crisis is going to produce a profound discussion about the future of multilateralism and global governance, we're doomed. We learned from your leadership and others during the financial crisis that you have to fix on an issue and then create a institutional structure to solve that issue, but also serve as the basis for other issues. In 2008-9, the issue was the financial crisis, and the G20 was created to try and fill the vacuum. The hope was that having established resourcing and coordination to fight the financial crisis, the G20 would then develop, representing 80% of global GDP, will develop beyond the economic realm. Now, the G20 is slumbering at the moment, partly because of the rotating chairmanship problem. But I think that the method that you used 10, 11 years ago was right. And the method is to fix on the real issue and then try to design a global response that is adequate to that issue but has broader lessons. And so in the case of the COVID crisis, I think health is where we start. The gaping holes in the global health safety net are exposed by the crisis. They're threatened to be deepened or widened by the crisis. And so the response needs to be about the right kind of international resourcing and coordination on global health that can establish the right principles that can then be taken wider into the multilateral domain. And here's a couple of thoughts for you. Thought one, there is a battle coming about whether the WHO's problem in this crisis has been to be too strong or too weak. The Trump administration's argument is that it's somehow got too much money and has done the wrong things. Look, the truth is the WHO lacks independence, it lacks resources, it lacks executive capacity, it reflects the divisions among its members. And so point one is that the WHO part of the global health needs to be strengthened. Just to give you one example, the inspection powers that exist for the International Atomic Energy Authority, they should exist on the health front as well. You want to have open access, you want to have clear reporting, you want to have proper independence. So the first part is about the WHO. The second part of the global health bargain, I think, is that actually global health has been an arena of real innovation in the last 20 years. If you think about the Global Fund for TB, AIDS and malaria, if you think about Gavi, the global group on vaccines, those were not implanted in a traditional way in the UN bureaucracy. They were created as a genuine kind of multilateral public-private partnership. And I'm not saying that can substitute for the United Nations structure. You need the WHO, but there's a lesson there as well about the private sector and the way in which coalitions of the willing can come together to have real dynamism, because both those agencies have had real dynamism. Let me just finally say something else, and I'll try and tread delicately here without just looking like I'm pleading the NGO corner. But it really grieves me that 10 weeks into the crisis, the people who are not getting the money are the NGO frontline workers to do their work. Right? It's just absolutely patent. If you look at the UN appeal that was issued in March, $2 billion appeal, $1.5 billion gone to the UN, $37 million has gone to the NGOs all across the world. Not $37 million for us at the International Rescue Committee, $37 million for all the NGOs. Right? We've raised $30 million of our own money from the private sector. We've not had a penny from governments. So
how much has been raised by the UN Special Appeal period before you go to the 37, which has come from it for the NGOs? How much have they raised?
$1.5 billion.
Oh, so you got 37 out of 1.5 billion. You're not doing well, mate.
Well, no, but it's not just the International Rescue. I'm saying there's a real issue about frontline funding, because just to go back to something I said earlier, if it's correct that the disease hasn't yet run rampant in the communities that we serve and that are not being tested, but where we hope that the disease has not yet run rampant, then my God, the hand washing, the fever testing, the isolation centers, the public information becomes absolutely key. And you cannot do that from 30,000 feet. You can only do that with local aid workers. And those are the people that the NGOs hire. And so you asked about resourcing, and the resourcing of the front line is not being done right at the moment. And it's my duty, it's my duty to just say that. And to, if you go to Jeremy Conondike's Twitter thread yesterday, he's gone through UN, USA, EU, UK, he's gone through them all, and it says, look where the money isn't going. And it's not going to the front line. So the resourcing issue is chronic. As it happens, the coordination issue, Valerie can speak to this better than I, the coordination's okay. I came from outside the humanitarian sector 6 years ago. The coordination isn't the big problem. People always say to me, oh, well, how do you make sure that you don't turn up in the same part of the same part of Kampala to do the same work for the same DRC refugees as another NGO? That's not the problem. The problem is that the resourcing is not going to the front line. And sorry, you've got me going, but just to finish off, because there's when we talk about the international aspect of it, we can neglect the local. The lesson of Ebola is that it was local activity that beat Ebola. It wasn't the sort of the 10-ton tanks that came in from the outside. It was actually trusted local people explaining why local burial practices that involve people rubbing the bodies of dead people was a really dangerous thing to do. And so I think there's a really big, as we think about global architecture, which you've invited us to think about, we've got to think about local resourcing, local people, because I don't know about you, but what I'm seeing is African countries saying, well, we're not taking any lessons from, we're not going to copy the Americans or the Brits on this thing. So if you're Ethiopia, you're actually more confident in your own system than you are in someone else's. That's actually healthy in many ways. But there is a technical resource, support expertise, infrastructural expertise that can come from the international system, including the NGOs, that I think is very important.
Kevin, before we come back to the local, which I think is absolutely critical here, can I just pick up on a really important point that David made in relation to the role that you, Gordon, and others played in terms of the creation of the G20. The important thing about that was that you were prepared to be disruptors. You were prepared to be champions, but you were also prepared to be disruptors, to look at the issue and how you deal with these issues in a different way. And we don't have that. We don't have that now, which is disruptors who are disruptors in the system for a positive purpose. What we have are disruptors in the system for negative purpose. So this point about leadership that we have talked about a little bit, and the importance of global leadership, it's also about those leaders who are prepared to think differently, who are prepared to think about what does the world need right now, and the creation of those health institutions, Gavi and the Global Fund, for example, also feed into that model. Of course you have, a World Health Organization, you have a UN system that operate in a particular kind of way, and to a certain extent, what they are sometimes able to do is constrained by the fact that they are membership organizations and are held back by what those countries that are members of the organizations want to do. You need that disruptive leadership to take it in a different direction. And I really want us not to lose sight of this point, because I think in terms of where the world goes from here, and David's very important point about you go to the lens of health and then you take it out from there in terms of the principles which you're able to establish, is really crucial. Because going to the UN, going through the Security Council, going through the executive committees of the World Health Organization are not going to take us forward in the way that we want to move forward. And then let me just 100% endorse his point about the local. In every single situation that I saw when I was responsible for coordinating humanitarian response at the UN, it is always the people on the ground, the local, working with international NGOs, but crucially, the local NGOs, the local communities, who are the first responders. They're the people who know their community, understand what is required, and are able to work hand in hand to make things happen. And absolutely, it took a while for us to get all of this off the ground with Ebola, because at one level it was seen as a sort of big international response with the international community coming in. But until you had sorted out the fears, the resources, the capacity, and understood the culture and had the knowledge of the local communities, it was very, very difficult to make progress. And that is what we are seeing now. And that's why the resourcing of those NGOs is so critical.
Well, thank you both of you on those points that you've made. They are sharp and go to the essence of the challenge which lies ahead of us. I'm taken by what both of you said about being institutional disruptors at a time of, let's call it existential crisis, which this has been. And you're both right to say that in terms of the disruption / innovation that occurred a decade or so ago with the global financial crisis, it happened reasonably quickly and at a very high level when a number of us worked out that this implosion in the United States subprime market was about to overwhelm each and every significant private financial institution in the world and then reverberate back to their governments as lenders of last resort. And the second conclusion, made rapidly, was that whatever purposes we established the International Monetary Fund for, frankly, this was beyond them. And therefore we had to innovate rapidly. So the principle is, as you've both described. The application, drawing on both your comments, is taking this public health crisis as the central organizing principle for what we now do, and to breaking it into its component parts. One, if you like, is partly for the future, which is David's points about the internal powers and resourcing of the WHO itself. We've been around that racetrack multiple times. I, in fact, chaired a review of the UN system in 2016, and we produced an entire report on global pandemic management, which made each and every recommendation which David Miliband just referred to about powers of inspectorate, independence of the Director General, independence of the member states. And of course, in the period from 2016-17, when the Ebola lessons were just washing through, in the subsequent 3 years, as we'd say in Australia, bugger all was done about it. It just ran round in a circle. So if we're serious about this for next time round, whenever next time round is, and maybe sooner rather than later, and this is either done or it's not, in terms of creating an effective, more powerful and better resourced WHO. On the second point, which is David's point about innovation in delivery, that is about to hit us between the eyeballs if and when we get a vaccine. What will be the vehicle through which a vaccine is distributed across the world? We innovated as an international community a decade or so ago in the creation of Gavi. And Gavi, I think those of us who have watched it closely, has by and large been hugely effective given its mandate. And each of us, I think you did this, David, I did, were writing very large checks to Gavi as aid ministers and foreign ministers to make sure it could do its job. And it did a very effective job. And is it therefore being groomed right now to take on the responsibility to be the at-scale global distributor and administrator of a vaccine if, for example, it comes on stream rapidly, which the medicos predict it won't, but let's just say it does? Is the capacity being put in place for that to occur? And then the third point is the one which you've both made eloquently. And in my own reflections on what happened with Ebola, you're absolutely right in terms of local frontline health workers being the key. And if what we know about COVID-19 at present, the implications, while not identical, are nonetheless similar. And then we get to the horrifying point that David has just told us. Out of 1.5 billion raised in the UN flasher field, 37 million has gone to the frontline workers. I'm tempted to ask David where it's gone. In fact, that's where I will take the conversation now. But here is, I think, a sobering point as we go to the last 10 or 15 minutes of our conversation, which is this. I remember writing a piece in the end of February, I was still in New York at the time, saying China's January and February will become the rest of the world's March and April. I couldn't get it published in the New York Times because they all thought I was smoking something, because this was an Asian problem. No, actually it was a Chinese problem more specifically. I wonder right now, when the reflections are written by year's end, we will be saying something like, why didn't we prepare now for what David has alluded to, which is the unfolding possibilities in the most vulnerable countries in Africa, the Middle East and South Asia. In terms of part of the WHO's core function and other international agencies, which is building up frontline worker capacity to deal with this on the ground. So David, your thoughts on that, and you might also reflect on where's the cash gone, my friend? Yeah. Over to you.
Thanks. I mean, your point, though, I think is if anything even more important than you're suggesting, because the actions that are necessary now to help prepare for a disease running rampant that might come in a month or two's time, those are no regrets moves. I mean, building out the sanitation infrastructure, building out the health infrastructure, building out the livelihoods for people in the most vulnerable circumstances. It's not like taking that preparation is ever going to be wasted effort, because it's part of what should be a basic global bargain. And I think your notion that we're spending all of our time on the firefighters at the moment, and of course they need to be praised and and supported, but we're not spending enough time on the fire preventers, is absolutely right. And maybe you should write. You should try again with the New York Times. But the basic preventative measures, and when I ran through them very quickly earlier, I said It's about sanitation and hand washing, including soap. For want of soap, a disease takes root. You know, for want of a testing station for fever, not just for even if you can't do full COVID testing, let's test people for fever. Okay, they might have malaria, but it's quite good to catch that as well. At the moment, people with malaria are not going to health centres because they don't dare. So let's do the fever testing and isolate those who've got the fever. And then I also am building the isolation centres. We're actually building some in Cox's Bazar in Bangladesh. But I also want to make one other point, which is, and I ran over it quickly, proper information is absolutely key to this. The most valuable asset in a health emergency is not a health system, it's public trust. Because if the public don't trust you, they're not going to go to the health centre. And that fake news problem, someone rebuked me for even using the term, because it almost, we shouldn't add the word news, the word fake. I mean, the world of alternative facts is or non-facts, or invented facts, or fiction, maybe it's the world of fiction, is polluting this drive too. So it's quite a big agenda, and it's a no regrets agenda. And obviously with the UN system under attack, they're girding themselves not just for the disease, but for political attack. And that's the worst possible circumstance in which to do this. I've been saying for 2.5 months, we've got the gift of time and trying to inject urgency. We seem to have more time than we might have guessed, although I do say to you that the numbers being tested positive in Afghanistan is very high. The numbers who were tested in Pakistan, 2 days for 5,000 new cases last week. So it's beginning to tick up. One's got to be careful with those testing numbers, because if they're only testing people who are reporting at health centres, then obviously you'd expect the numbers to be higher. But I think that this agenda of filling the holes in the global safety net, sewing up the global safety net, is a preventative, no regrets agenda. And at the moment, because they're manning the firefighting stations, it's obvious that the WHO, that's got to be their priority. But there is also this preventative health agenda, this public health agenda, that obviously is absolutely core to livelihoods.
Well, you're right. If you look at the system...
Kevin, sorry to interrupt. I mean, I wanted to add one other point to the points that David made, because yes, it's about prevention. There's the current firefighting, but there is also the dealing with the current crises that David so eloquently set out at the beginning of our conversation. That is ongoing, and there is a real issue about capacity and capability, and how in countries like, South Sudan, Syria, and elsewhere, you are able to give the support for the current response, look towards preventive capacity, and think about planning for the future. And in relation to your point about vaccines, it is not just, in my view, about the distribution. It is also about where those vaccines are produced. I mean, we had that whole debate, and it was almost a fight all those years ago in relation to HIV and AIDS. What have we learned from that so that the vaccines can be produced in the countries that have the capacity, and then the distribution network is more straightforward?
Well, what both of you have said about prevention just makes so much sense, as David's core point is that none of this is wasted. I mean, in my spare time, I'm chair of Sanitation and Water for All. The figures given before, about 3 billion people on the planet without safe and reliable sources of water and effective sanitation, is true, and it's not improving. So if you drill down on the basic conclusions that have been arrived at in countries affected by the virus radically so far, David's kind of gone through the list. Soap. How do you teach effective personal hygiene? How do you teach and enculturate social distancing if and when it happens? And these basic principles, which goes back to what David pointed to before, which is the fact that funding for the COVID-19 humanitarian aid effort needs to be directed to frontline health workers. We've got less than 5 minutes left. You both are highly experienced. If I could ask you for any concluding thoughts, given where the conversation has gone so far, but if you were providing some advice through the airwaves to the UN Secretary General right now, what would it be in terms of what should now be done? And if I could load the question with one element, which is borrowing on Valerie's point just before, what further should be done in terms of preparation for vaccine production and delivery if and when one arrives? But open question, really. David, you first, then Valerie, and then I'll close our session.
Thanks, Kevin. I think the first thing I would say to Antonio Guterres is keep going on your call for global ceasefires. He made an important call 2 months ago. He used the bully pulpit that he has to say that COVID doesn't respect sides of a conflict, and he called on all those involved in combat to have a COVID ceasefire. Now, actually, in Colombia, that followed. It's been followed on and off in Yemen. It's not been followed in Afghanistan. Keep going on that, I would be saying. And it speaks to Valerie's point about where the breadth of the international vacuum, that the UN Security Council hasn't even been able to agree a call for global ceasefires because it can't mention the WHO. I mean, it's completely ridiculous. It's a total absence of leadership. So the first thing I would say is keep going on that. The second thing I think is out of his hands, which is that in a world that is as fragmented as it is, I think it's really important that Western countries, and by that I don't mean countries of the geographic West, I mean countries of liberal democracy, need to harness their efforts together, not to fight a new Cold War against the Chinese, but actually to cooperate, to negotiate, and to compete effectively around the world. And the fragmentation of the quote-unquote West is, I think, a real torpedo at the fundamentals of the international system and at the ability of people like the Secretary General of the UN to do his job. In respect of the vaccines, when we wrote our 5-point plan for how we're going to deal with COVID, we deliberately started with prevention, but we ended with the vaccine. We're the last 10 miles of the vaccine. And to the extent that it's true that the disease is not vanquished anywhere until it's vanquished everywhere, and we don't know about mutations and all sorts of other dangers, that last 10 miles becomes absolutely key. And so I would be looking to the UNSG to get onto the front foot about what a vaccine distribution and production, to pick up Valerie's point, plan would be. And interestingly enough, some of the pharmaceutical companies are actually cooperating with each other much more than before. And so there may well be some ground for learning from the initiatives in public health in global health over the last 20 years. So I think that don't wait would be my message. Get out there with some ideas and let's start making sure that we prepare the ground properly. Actually, there was an EU-led summit on vaccines 3 weeks ago, and that was about the funding of it. But I think the distribution and production is equally important.
Thanks so much, David. Valerie, the last couple of minutes for you. You've advised UN Secretary Generals before, and so we'll be particularly attendant on what you've got to say now. Over to you.
So I would add 3 things, and linked to David's don't wait point. One is have the courage to find the positive disruptors in terms of leaders and work closely with them to see how you can disrupt the system in a positive way. Secondly, continue to do what the UN, I think, has done very well in relation to the SDGs and other areas, which is to promote those partnerships between the public and the private sector, particularly bringing on board the private sector. And the third thing I would say is, yes, you are a global international organization, but be the champion and the advocate for NGOs and those local responders on the ground. It's a role that the Secretary General has played in the past when he headed up, for example, UNHCR. It's a role that he has played in the past as Secretary General, and I think it's a role that he can continue to play as that advocate and champion.
Well, good. Thank you to both of you. Intelligent, constructive disruption, organising principle, the challenge at hand, in this case public health, be proactive and preventative, as well as attending to the fire that's underway at the moment. And thirdly, in terms of this challenge, look at the production of a vaccine and its distribution as a global public good and make preparations for its delivery at scale. To both of you, thank you very much for joining us for this discussion. Valerie, you're not in the front line right at the moment. I hope you return to it. You're good at it. David, you are in the front line. And to anyone listening from across the international community, reach for your checkbooks and make sure you write out a check to the International Rescue Committee. It does great work around the world. Or contribute to other UN agencies or other agencies, David's not a UN agency, who are engaged in this good work around the world. But thank you both for being serious global citizens.
Thanks, Kevin. Great to be with you.